Welcome to the Ohio Adult Allies podcast. We are developing, inspiring, and empowering youth leaders. Today we are learning about prevention specialists. Now here's your host.
This is Holly Raffel from Ohio University's Voinovich School of Leadership and Public Affairs, and I'm really excited to bring you our first crossover episode. In this crossover episode, we'll learn what is the value of the prevention specialist. And our podcast today was produced by the Ohio Prevention Specialist Development Fellowship, and you'll meet 4 individuals, and they are going to give you the skinny inside, outside, backwards, and forwards on what it means to be a prevention specialist and how they add value to all of our communities.
Hi, I'm Mary Wolff from the Ohio Suicide Prevention Foundation, and I'm really honored today to have 3 amazing prevention leadership professionals with me to discuss what is a prevention specialist, why do we need them, and how do they benefit a community? So we've worked alongside each other for a fairly almost a year together, and I think it's important that everybody gets to know who's here. So I'm going to have Laura introduce yourself, please.
Hi, everyone. I'm Laura Busler. I've been in the field of prevention for over 15 years. Currently, I'm the Associate Director of Marion-Crawford Prevention Programs. We are a standalone prevention agency serving the Marion-Crawford areas. We have a really strong foundation in youth-led prevention and work a lot with middle and high school youth. And I am a product of Youth-led Foundation from our area, the Teen Institute program.
That's awesome. Georden, give us your introduction, please.
My name is Georden Burton. I've been in the prevention field for about 8 wonderful years now. Currently, I'm in a new role as a prevention program manager at Community for New Directions. It's a nonprofit that focuses on empowering communities across the lifespan. We do prevention, intervention, and treatment services.
Glad to have you here too. And finally, last but not least, Abby.
Hi, everyone. My name is Abby Beausir, and I am the Manager of Community Outreach at PreventionFIRST, and have been in the prevention field coming up on 5 years. And at PreventionFIRST, we are a regional nonprofit focusing on youth substance use, suicide, and gambling prevention.
So, my friends, let's take a journey. And our journey is about prevention specialists. You know, what are they? Who are they? Where do they work? What do they do? And for people who are maybe trying to consider, is this a path I want to take? We want to help them better understand what that is. So first and foremost, Laura, could you maybe give us a definition of what is a prevention specialist?
Sure. So a prevention specialist are so many different types of things. They come from diverse backgrounds, but really it's a caring person who wants to make a difference in their community, and they aim to prevent people from using drugs, alcohol, suicide, gambling prevention. They're really the unsung heroes of your local areas.
Wow. How are the prevention specialists trained, Abby? Are there credentials involved?
Yes, and a great question. So through prevention specialists are actually certified in the state of Ohio through the Ohio Chemical Dependency Board, and the credential for the Ohio Suicide Prevention Specialist, as well as a prevention consultant, does require additional education beyond a high school diploma and or a college degree, and does require some continuing education, behavioral health prevention, but the goal is to receive these certifications and provide prevention specialist expertise in the state of Ohio.
That's amazing. Georden, what role do prevention specialists play in promoting health and wellness in community?
That's a good one, Mary. We play a bunch of different roles in doing that, but most importantly, a vital role in promoting health and wellness in the community, because we're often the first, or maybe even sometimes the only ones that are doing so with the people we serve outside of, maybe a doctor or a dentist. We also get to do that in creative and engaging ways that reach a lot of people at once, be it individually through direct service, social media or messaging campaigns, even by advocating with some state legislators sometimes to change laws that make it easier to just enrich people's lives through health and wellness. By nature, we're a proactive field. Instead of a reactive one, we like to address, mental and behavioral health problems before they can blossom, instead of reacting to them and playing catch up when they do, which isn't always fun. And overall, it's our specialty to, again, just empower communities and give them the tools necessary to make healthy choices.
That's amazing. So basically, you're trying to say that because we're here, nothing bad happens.
I wish that were the case, but often in our field, we don't know how good we're doing our jobs because something doesn't happen, right? So
Exactly.
So of course, there's going to always be bad things that happen, but I would like to say that there are less things that happen because of the work we do.
Awesome. Abby, how can prevention specialists, they're very different from volunteers. And there are a lot of people that work in community that promote health and wellness, but what is truly the difference between a prevention specialist versus a volunteer who's maybe doing good work, but not certified?
Yeah. So also another great question. So essentially, prevention specialists use science-driven and evidence-based approaches. So they follow a strategic prevention framework, and which is also a public health model that drives their decisions and drives how they impact and make change in a community. So they follow these approaches and, can go in line with the volunteers in the community. And other examples of volunteers could be coalition members that want to carry about change in their local community. So it is a little bit different. It might be a little bit more structured for carrying out prevention approaches.
So it sounds like that this effect on community is a big deal. And the work that you guys are doing is amazingly important to changing communities. So let's talk a little bit more about, what do those communities, are there specific ones? So Georden, you were talking a little bit about working with children and young people. So how do children and young people benefit from having prevention specialists actively working in community?
How much time do we have, Mary? Children and young people benefit from having a prevention specialist in the community in just a million ways. Me personally, I've literally seen it change the trajectory of their life. Like you said, my background is in school and after school based. I do elementary all the way to high school, and I'm in the same part of town too, so they're stuck with me forever. And through that, I facilitate programs that just teach them, the essential skills that everyone could benefit from in life. But unfortunately, some of us didn't get the opportunity to have those skills taught to us or, receive them. Things like healthy coping skills, problem solving, how to be confident in yourself to say no to things you don't want to do, which is still hard even for me as an adult, right? What healthy relationships look like, emotional regulation, the list goes on. And one of my favorite parts about it is that we provide a safe space for them to explore these things because safety is of the utmost important, especially in my community, because my kids are growing up in the heart of the opiate epidemic in Columbus and everything that comes with that. They've just been through so much and they'll continue to go through things, but they get to learn how to be resilient and how to work through them. They grew up around just death, honestly, literally and metaphorically, trauma, peer pressure, gangs, SWAT raids, incarcerated family members, like you name it. Like I've had middle schoolers that have had to Narcan their parents and kids that were best friends in elementary school and now they're in high school and they're shooting at each other. It's wild. It really is. But also because of that, I get to see a lot of growth and resilience, like I said, and that's one of the most meaningful parts about my job, and just seeing people that are grateful for the support that they receive to make positive choices in an environment that is mostly negative, and I'm not taking credit for any of that either. It's all my kids. They were just given the opportunity to join a program but they did the work, and they just needed just a smidget bit of guidance and support and made mountains out of it. And I would say the same goes for us as a field in general. You know, we're given opportunities to go out there and to truly make a difference with people. You know, this field saved my life in one way or another, but that's a story for another day. So.
Well, we are definitely going to have to do another podcast on that, Georden. That's amazing. I mean, essentially, it sounds like prevention specialists are really bringing hope to communities that maybe so desperately need it. And you may be that one caring adult that is reaching a young child who is experiencing so much trauma, and they simply need to know there's some stability. That's amazing. How about Laura? I know you talked a little bit before about being a product of youth-led prevention. So how do adolescents and young adults benefit from having prevention specialists actively working in the community?
Well, I mean, as we all know, middle and high school ages are such a unique time. So many new experiences, emotions, trying to navigate all that. And I think prevention specialists can be like kind of the glue or the reinforcement that they need, or to help them be resilient. And prevention specialists can give them the knowledge, skills, and attitude, and help them guide them into hopefully making positive choices. So in a youth-led prevention is a program I grew up in. And so 25 years ago, a prevention specialist made a difference in my life, and I would not be here today if it wasn't for a prevention specialist. My siblings have been involved in the program. We're in contact with a lot of our young adults, older adults, and we've remained in their lives. So those bonds and relationships, you really can truly make a difference in that age.
Wow. So it sounds like prevention kind of follows along with a person through just different stages and ages of their life. So how do parents and caregivers benefit from having prevention specialists actively working in the community? Abby, maybe you could speak to that.
Yeah, definitely. So, and parents and caregivers are a direct benefit and resource to the young people that they are raising. So one example we have at our organization is Parenting for Prevention, a training that we provide directly for parents and caregivers, and including foster parents as well. And this training is normally paired with a parent guide that we have at Prevention First, and basically goes through any life cycle or stage from ages 3 to 18, and it goes through healthy talking tips for substance use, for bullying, for gambling, and every life stage depending on the age of the young person that parent is raising. They can hold on to that booklet and really share those talking tips, and it opens a conversation between the parent and parent caregiver and that young person. So it opens up communication channels, and it's never too early to start having that conversation. And it's always a great way for parents to be that positive influence, and have some of that that learning opportunity for that parent and young person.
And I think as we were coming out of just an absolutely historic pandemic where everyone has been affected in multiple ways with stress and wellness, and we're seeing some things in our communities that may or may not be good. How do adults and seniors in particular benefit from having prevention specialists again in that community? Abby?
Yeah, so something that we've seen over the past, 5 or so years with the influx of the opioid epidemic, that we've seen an increase in relatives raising relatives. So that's predominantly grandparents raising grandchildren due to the impact, once again, of the opioid epidemic. So a lot of these grandparents are stepping in as that caretaker or guardian for a young person, and they need some extra support because it's been a while since they've done the whole parenting tradition. So a lot of times these senior citizens need some extra support on parenting this new generation, and also seniors and relatives that are older can also be a positive influence as well for a young person. I personally look up to my grandma, and she is my mentor, has been my entire life. And so grandparents can definitely be a great resource. And also with the senior population, a lot of them need some extra education on medication safety and on locking up their medications and disposing of them properly. So that's a prime example of how some environmental strategies for prevention can impact the whole lifespan.
And you know what I think is fascinating as you guys are discussing, what the benefits are in the community. This is being a prevention specialist is very intentional. There are specific things and specific ways in which we all work with people in community and individually and in groups that are really grounded in science and grounded in things. We're just not making it up as we go. So basically, Abby, can you talk a little bit more, what kind of evidence supports the work of prevention specialists in the community, and kind of like maybe data evaluation? How does that work?
Yeah, so like I mentioned earlier, prevention specialists and public health professionals, specifically in the behavioral health prevention field, we make all of our decisions based on data and follow evidence-based practices. So that means we gather data routinely, and we look at, say, local drug trends. We look at new student drug use survey data, and also with the impact of, say, a traumatic event like COVID that has really affected a lot of really everyone within the world, honestly. And so really you look at evaluation measures, and it could be very large scale with doing a large community level survey, or it could be very small, like looking at emergency level data, or the health department gathers a lot of overdose data as well. And you want to focus on what is locally happening in your community, but also looking at regional or national level data to kind of compare, to see, how do we compare with our region, or how do we compare with the national data as well. And you kind of want to look at trends as well to see, hey, is from year to year, are there more drug trends? Are there less? Are there more mental health concerns among a certain population? So looking at trend data and looking at any new instances, and also that helps support if you're following grant deliverables. So a lot of prevention specialists work under either locally state-run or federal grants. So they do need to report back to their funder. And also that shows what kind of impact that they made in the community. And that can also be important to show to stakeholders, especially your grantor, that you did what they wanted you to intend to do, but also shows that you're accountable for those deliverables. And same thing with the community. So for every dollar that you put into prevention, you actually save on average about $17 on the back end. So prevention really does save money. So that's why in our field, we really try to promote primary prevention initiatives so that we can hopefully not just save money, but save lives.
I think that's the really most important part of the work that we do. I think we all do it with a heart for wanting to save lives, because whether it's suicide prevention or drug use prevention or gambling prevention, these are significant factors that will really make a huge difference in someone's life if we're able to prevent them from having to experience the bad outcomes that can sometimes happen with those areas. So Georden, you talked a lot about kind of different entities that employ and contract with prevention specialists. So who do prevention specialists work for when they're promoting health and wellness?
We work for all kinds of people, but different examples would be at every level of society, like any person or organization that wants to help mitigate a behavioral health problem or issue might work with a prevention specialist to do that. Like I said before, be it schools, a nonprofit organization, a government agency, a health department, the justice system has been getting into prevention a lot, especially with restorative justice. And, they kind of realize that they can't arrest their way out of the drug problem. So they're starting to work with prevention specialists, nursing homes, casinos to, kind of that gambling addiction piece. And now I feel like even as a field, we've grown a lot since the 80s, and we're going to continue to grow because of the funding. There's a lot of federal dollars that are coming down now because they see our value as a field, and I'm looking forward to that growth because, again, we definitely evolved from just strictly focusing on drugs and alcohol.
I mean, it's just fascinating to hear all the different ways that prevention impacts community, impacts special populations, that U.S. prevention specialists can do a lot of different things. That is very appealing. And I think when people are looking about how do I want to be a part of the world and what purpose can I serve, and if I want to serve my community, being a prevention specialist is really right up there with very actionable kinds of activities and training. So as we're wrapping up our podcast, I really kind of just want to pose a question to all of you, and really just give me kind of a one or two sentence answer, if we think we can. If you could summarize really what is the value of a prevention specialist in one sentence, and why would you say that? So Laura, I'm going to start with you.
I would say that prevention specialists are some of the most suited people to make a difference in the lives of young people. One sentence.
Excellent.
Did it.
That was good. Abby, how about you?
Yeah, I would say that prevention specialists are community driven and work across the lifespan. So like we talked about earlier, it really impacts the youth. It impacts the parents that are raising those youth, and then also grandparents or relatives that might be raising a little one as well. So it crosses all age levels and all levels of the community. So prevention is really impactful across the generation.
Excellent. And Georden, last but not least.
Well, they summed it up great. So I will say prevention specialists are superheroes without tights. They make the world a better place.
That is fabulous and awesome. That was amazing. I love that. So, as we're wrapping up our podcast, I think, where we were talking about, if somebody were interested in going and finding out more, can each one of you pick a place to go for more information about being a prevention specialist? So I'm going to go back to you, Georden, Mr. Superhero with no tights.
I would say the Ohio Chemical Dependency Board is a good place to start off, especially when it comes to kind of the certifications and things like that.
Yeah, that's a great idea. Abby, where else could they go?
I'd say the Ohio MOS, so the Ohio Mental Health and Recovery Services Board, and also there's local ADAMHS boards as well. So if you want to find the local county or multi-county ADAMHS board, they provide a lot of trainings and opportunities to get continuing education and provide a lot of resources for the community.
And last but not least, Miss Laura.
I would definitely recommend ADAPO.
Great. So this is where you get the information. If you really want to know more about being a prevention specialist, reach out to us. We're available. We're in the community. We will answer any questions that someone has. We want to see more people who want to do this work because it is so gratifying and it is so important. And no matter how hard we work, there's still so much more work that needs to be done. So please join us, become a prevention specialist. It'll be the greatest job you will ever love. So thank you for joining us.
Thank you for listening to the Ohio Adult Allies podcast. You can find more of our episodes on iTunes, Spotify, or Google Play by searching Ohio Adult Allies. More episodes are available on our website, www.ohioadultallies.com.